Medcare is transforming healthcare through exceptional patient experience. See how they partnered with Exotel to revolutionize appointment management, improving both patient care and efficiency.
The nurses, they get burdened with a lot of non-core activities or operational activities. If you see, almost 1 hour of a bandwidth of nurses was going in calling the patients, and sometimes patient will not respond to their calls and they have to call again. So and because of that, their core activities were getting impacted. And then during our town hall, they have raised this concern. Then we thought, okay, fine, let's have a brainstorming and we can see how technology can play a role into this. That's the time this idea has emerged.
Before Exotel, Medcare faced high no-show rates and inefficient manual processes.
The manual follow-ups is the main challenge for Mosh. Engage at least 3 or 4 employees to do the no-show follow-up. And Mosh being a small unit, we need to make at least 250 to 300 calls per day. So if a patient wants to reschedule their appointments or cancel their appointments, they need to contact the call center, where the workload for the call center also increases, where they can focus on appointment scheduling rather than, getting the calls for cancellations or rescheduling. As well as we are not able to free up the slots for the doctors. That's the main challenge, where because of that, the no-show increased and the slots were not freed up. So it was also, in a way, affecting our revenue.
So we were looking at exploring multiple options, and we knew that the solution to this is digitization. And that was a time when I met Exotel in one of the conferences. And what really impressed me about the conference was, you did not present me a solution. You presented me a thought, you presented me a concept, and I could relate it very well to my problem. Mm-hmm. And that is when we started the journey. Said, yes, can Exotel be our partner? We have a problem, we don't have a solution. Exotel has solved this problem in a different environment, but I think the problem is same. And that is when the journey of exploration started. We ran a successful POC.
It is such a big relief for the nurses, It is because that, as I said, almost an hour every day, 1 hour, one nurse was spent into this. They are now able to give that much time for their core activities. Like I can tell you, my documentation compliance had increased, which was 50% or 60%. It has increased to 90%. That is one thing which I can tell you as an administrator. Then, in fact, even doctor satisfactions have increased. Our patients, if you see our patient NPS, that Net Promoter Score for the patients, we are handling the queries because nurses are available now to handle the queries.
Because now patients are getting reminders, and now it has also helped us to better the optimization of the staff as well, because now they can be utilized for better activities and not just and then lifting the phone and making the call to the patient and things like that. The main impact, and a positive impact rather, I would say, that we had was my no-shows that I was initially sitting at of a monthly average of 20 to 22%. It has come down drastically and exponentially to 7% final no-show. So how it impacted, because now the calls are going at like stipulated time during the day, where the patients are requested to confirm, cancel or reschedule their appointments. So that communication gap that they initially had with the hospital by the staff who was manning this process, that communication gap is reduced. So now out of my appointments that are booked for the next day, 90% of the appointments are getting confirmed, or at least we know the status of those, whether the patient would come or the patient would not come even. So that has actually helped me in bringing my no-shows to 7% now, which is a game changer, I would say. And that has helped us in getting more revenue also.
Then Exotel stepped in. That's when we found out that there is a lot of numbers that we can get, and then it's more clear. And also our no-show before was like 20%, now we move down to 4%, 4 to 5%. So it really helps us a lot, in driving revenues as well.
And again, where they, for just even example, if they're calling 100 patients a day, now it might be just reduced to 10 patients because of the cancellation of the reschedule. That's such a reduction in number, help in manpower, and the bandwidth utilization is very good at this.
See, you all know that Medcare is one of the premium healthcare providers in this part of the country. Now, for a premium healthcare provider, obviously the focus is definitely there on clinical outcomes, but we are always constantly researching, trying to understand how can we make the journey of the patient seamless, or I would rather call frictionless.
By partnering with Exotel, Medcare has transformed operations and elevated patient-centered care. Together, they're shaping the future of healthcare.